So, welcome. I would like you guys to introduce yourselves, right? So we're here again today at another Rumor Time conversation, and I have with me several wonderful people. So I would like them to introduce themselves and just what do you do? Why are you here? Beside me forcing you to be here. All right, so.
So I am Dr. Krista Cooper. I am an associate professor of social work at Andrews University, and my research agenda includes immigrant populations and HIV/AIDS and female reproductive issues.
Okay, well, welcome.
I am Anita Goodman. I am a speech-language pathologist working with adults primarily who have suffered traumatic brain injury. I'm also a mom of 4 people.
Oh, welcome.
My name's Fred Goodman, MD. I am a retired Navy physician, and I currently work at the VA, providing health care to those who gave all.
Welcome. Thank you guys for coming. So today we're just going to have a conversation as we do regarding the RUMERTIME process. And earlier Anita asked the question, well, what does CSS stand for? And for our audience and for the current, what do you call you guys?
Panel.
Thank you, panel. The CSS stands for Cultivating SEEDS System. And SEEDS is an acronym for Social Emotional Education in Diverse Settings. It is an organizing framework that helps to give context to human development, basically, from birth to end of life. And we look at people in their context, right? We use a contextual framework. So we look at people in their environments and how the environment impacts their behavior. We also look at the social emotional development of individuals within that context of where they live, they learn, they love, and they work, and how the social emotional competencies influence behaviors in those contexts. So that's really what the Cultivating SEEDS System framework is about. There's so many different components to it. One of the other features I would like to bring out is that it is we use an agricultural metaphor that helps to explain what the Cultivating SEEDS System framework is. And the reason for that is because it is agriculture is a universal construct. Mm-hmm. It is something that everybody has an understanding of. Everywhere in the world, I believe, even in the Sahara desert, there are trees, there's soil, so there are agricultural elements everywhere and people can relate. And because this framework is something that is used globally, I wanted to make sure that individuals have access, which is one of the 2 goals that the CSS framework has, is to make sure that access is increased, right? We want to increase access to the use of social emotional competence, and we also want to make sure that when people have access, they know how to utilize it effectively. Prior we were talking something about, you said one of your nieces went to some African country, and she was doing some work with dental...
With children who had developed a condition called NOME, I think it is. I can't remember. NOMA, exactly.
Right.
And it was a completely preventable condition, but the culture that they lived in, the community they lived in, didn't know how to prevent it. They actually had the resources to prevent it.
Exactly.
But they didn't know how to use those resources.
And that's another goal of the CSS framework, because you can have access, but if you don't know how to use the tools that you have access to is basically like you have no access, right? And so that's what you were saying. And when you said that, I thought that's exactly what we do. So we have two goals: to increase access and to increase the effective utilization of the social emotional competencies.
When you say social emotional competency, what do you mean exactly?
Right. So social emotional competence is basically helping individuals learn how to recognize, how to understand, how to manage, express, and reflect on their thoughts, their interactions, mindsets, and emotions in all the different settings that they find themselves embedded in. So a person is at work, at home, learning how to relate to others in that setting so that you can have outcomes that are productive and healthy. So empathy would be one of the outcomes or outgrowths of self-awareness or social awareness. And so there are 5 basic social emotional competencies or skills. And those are self-awareness, social awareness, self-management, relationship management, and responsible decision making. So I kind of came up with a formula. So it's S3, S to the power of 3, R to the power of 2. So S to the power of 3, there are 3 S's: self-awareness, social awareness, and self-management. And R to the power of 2, relationship management and responsible decision making. To kind of help people remember, what those basic building blocks are. And social emotional competence is basically the building blocks of healthy relationships. A relationship with yourself, with others, and in regards to how you interact in different settings or diverse settings. So, does that make sense?
It does.
Yeah?
I'm going to raise my hand and say, I don't get it.
You don't get it. Okay, so tell us what you don't get.
So what I don't understand is your program. Sounds great, but I don't understand what community does this apply to? What age group does this apply to? What situations does it apply to?
Okay.
How would I, as a physician, utilize what you have?
Very good question. This applies to every age, every setting, because it is about relationships. Okay. And we have relationships in every setting. It's about self. Okay. It's about being self-aware. It's about being socially aware. It's about learning how to manage yourself so that you get the results of whatever it is you're doing, the results that you're looking for.
So this would be a program that my staff might use to connect with the veterans?
Absolutely. Okay. And it's a program that you can use for your own self. Okay. Because in many of my curricular and activity books, there is the recognize, which is plot 1, recognize and understand. The focus, the social emotional competence or skill that you're learning, practicing, is self-awareness. And self-awareness is the definition that I use for self-awareness is that it is the ability to accurately and honestly assess oneself, your strengths, your weaknesses, your likes, your dislikes. So we all need to do that, right? It doesn't matter what setting you're in. It doesn't matter. And in order for us to, when you fly, you hear all the time, you guys just flew. You just flew. One of the things the flight attendants tell you first to what?
Take care of yourself first.
What is it?
Put on your own mask before you help.
Right.
Take care of yourself first.
Take care of yourself first.
Oh, I thought it was turn off your electronic device.
That too. But in terms of safety, right? In terms of safety, they say put on your air mask first before you help anybody else. Right. And before you can help, before the veterans, your staff can help the veterans, before you can help anybody else, before you as a mom can help your kids, before you as a professor can help anybody, you first have to know who you are.
I see.
Right? You first have to know. So this Cultivating SEEDS System framework is is what I call the building block. These are the building blocks of just conscious living, just living.
So this is to improve your community, improve your relationships with others.
Yeah.
So this might be a good program to be taught over the 4 years of medical school.
Absolutely.
So it's because physicians in general, they come from their own individual backgrounds, and they are dispensed among the world. Multi-different cultures, multi-different communities, and people they may have never met, and people they've never interacted with, and if they know who they are and how to interact, it might make them better healthcare providers.
Absolutely, absolutely. Because one of the theoretical frameworks that is included in this overarching framework is what we call the ecological systems theory. And we look at people as they are embedded in their system and subsystem. And so it's very contextual, it's very, very culturally responsive. So if you learn the basics, the RUMERTIME process, the Cultivating SEEDS System, it doesn't matter what symptom or what behavior, bedside manner, it takes care of all of that because you understand yourself, you understand how you relate to others, you understand how your mindset impacts your lens through which you see others and your patients. So you would be less likely to be discriminatory or to mistreat a client if you understand who you are in the context of the human development, the lifespan development. It helps.
And it impacts how you deliver whatever that service is.
Whatever that service is.
Teaching,
yeah,
pathology, medicine.
Being a mom, being a dad, because again, I say to the people, it really is like the air that you breathe. And it depends on what kind of air you want to breathe.
I want to breathe good air.
You want to breathe good air. And so you put in the foundational, the seed. You lay that foundation, and the soil is the environment. And so that's when I say to people, like, well, we have these issues at the school, or we have these issues at the workplace, where there's a lot. I did some training in a Caribbean island with a bank because they were having issues among the staff, the banking staff, where there were little cliques, and people were, just negativity. And so the director asked, well, would this work for them? Of course it will. Because what you were seeing, that behavior, we call behaviors fruits. And this program deals mainly with the root and the soil. Because once you take care of the root, the fruit will take care of itself. Right? But if you continue, and our society across the globe focuses on the fruit, and we expect that if we take care of the fruit, you get rid of the fruit, somehow in our minds we believe the behavior, the problem solved, and that doesn't work. Right?
You have to get at the root of
you have to get at the root of the issue, and at the root of the issue, my belief is the 5 social emotional competencies. If you take care of that, if you teach people to be self-aware, if you teach people to recognize their thoughts and their interactions and their mindsets and their emotions as it relates to themselves and others and situations, you don't have to worry about productivity, you don't have to worry about bullying, you don't have to worry about creativity on the job and cohesion in your communities. It will because people are able to look inward or at the root. So
So how might this work in an individual or individuals who have suffered trauma? Because we know that trauma sometimes can rewire, the brain.
Mm-hmm.
And so I'm wondering how this program might be used effectively with people.
Right. I just came back actually from Florida, doing a training in the Broward County schools, dealing with trauma. That's the school district where they had the the Parkland shooting. And so I worked with community and the social workers in that area on trauma and the use of the system. And so again, the same concept, dealing with the root. So you deal with the person's ability to look at themselves, right? The traumatized person who's experienced trauma, help them to see, okay, what in this situation, what were my thoughts about the situation? How do I respond to the trauma? How does the trauma cause me to behave, which is the interactions? What are my mindsets now? What mindset did I have prior? What mindset do I have now? What mindset do I want to have in the future? Because I am able to, just like how the trauma rewired the brain, they can rewire. And this is a process, a 5-step process that helps people move from imbalance to balance, interpersonal and intrapersonal imbalance to balance. And so, so that's the process. That's what they will do. Again, going again to the root, which is, your thoughts, interactions, mindsets. How am I behaving? Why am I behaving this way? What is causing this behavior? And then the managing. How can I manage myself, my thoughts? Because we can, you can manage what you can't control what comes in, but you can control what you do with it. You can manage how you allow it to have, what types of effects to have on you, the level of impact it has on you. Is that?
Yes.
All right. Anything else?
Well, have you been able to measure the efficacy of the program?
I have. I'm just so glad you asked. I have. So last 2 years, I've been working with a school district here not here, but in Michigan, close by the school district, where I was a part of the interviewing and hiring process for the intervention specialist, the RUMERTIME intervention specialist, and also I trained them basically over 100 hours of training prior to the start of school in 2016. And they used this intervention alone to help reduce academic behavioral referrals, to increase academic achievement and also attendance. And we know, again, those are fruits, right? Those behaviors, those are fruits. In this framework, that's what we call those. So we looked at, why are the students not achieving academically? What are the barriers? Why are they not coming to school? What are the barriers? Where is the behavior coming from? Why are they behaving in the ways that they're behaving? And so we focused on that. And one of the main interventions, one of the main assessment tools that we used was what we call the emotion intensity, the emotion intensity chart, and also the emotion intensity survey. So students will come into what we had, what we call the daytime intervention room. So these are kids from K to 12 who were referred to the intervention specialists who've now been trained. They would come into that room based on a referral from the principal. And this was the last step before suspension. And one of the first things the intervention specialist would do with the child would, and I don't have it here with me, but it's in the green room. We have an emotion intensity chart with the emotion faces, emojis. You saw that. And there were 4 rows. And in each row, so the first row is the low emotion intensity level, then the medium, then high, and then very high. And so when the students would come in, the intervention specialist will ask them, where are you on this emotion chart? And then they would use one of the many intervention tools that I have for however long in the session. And usually what we found that any child that stayed in the session for more than 30 to 45 minutes, there was a statistically significant difference when they came in and when they left. And so they will do their intervention or the treatment in the medical world. And when the student leaves, ready to leave the room, they will ask them again, now where are you on this emotion intensity chart? And again, you would see, and so from emotions will go from 1, which is the lowest, to 10, the highest. And it was, again, statistically significant. And you would see, so they would come in and they would be at a 6 on the scale, 6.5 or so. And when they're leaving, they would be at a 3 or 2. So the significance was at least 2, or I'm saying 2, about 3 or 4 points. And that is huge. Now, you may ask the question, well, why are you checking their emotions when they sent them in here for attendance issues? And because the emotions were barriers to them succeeding, right? So it became a block in terms of them making good decisions, which is one of the social emotional competencies, right? Responsible decision making. Social awareness. Emotions have a lot to do with that as well, because being socially aware is being other focused, helping you to see how others feel, empathy. And when your emotions are out of control, especially the ones that are not, whether it's good or bad, if it's not controlled, it gets in the way of you achieving goals that you set out to achieve, or that you need to have set out to achieve, right? So we wanted to help our students, first of all, recognize what those emotions were, where they are on the intensity scale. Once they recognize and understand, okay, well, why am I feeling what I'm feeling? And that's the understanding, right? So you dig deeper with the understanding, and then we're helping them to manage. Because once you become aware of it, you're now able to manage, and we give them the skills to manage. And so when they leave the room and their emotions are under control, they're now able to go back into the classroom with an understanding of being self-aware, but also with tools now to manage. And so now they can learn. The pathway is now clear for them to learn whatever it is you want them to learn. So, yeah. Yeah? Sounds good.
Yeah.
All right. So thank you guys. Any other questions?
Not right now.
Not right now.
Maybe next time.
So next time, we'll pick up from where we left off and, take a look at all the products and see how you might be able to use this in whatever setting you're in. Maybe go to our website, www.gcscore.org, and find us on Facebook, YouTube,
Everywhere.
Instagram. Yes, we're everywhere.